our main concern right now is just COVID.
It feels like we're soldiers in a war. We're being sent out without camouflage, without Kevlar.
It doesn't matter how many ventilators we get if we are dead and cannot run the ventilators.
It's making me so emotional. The fact that we can't take care of patients is just, it's unspeakable. My name is Shannon Bruno, and I'm a 27-year-old registered nurse from Seattle, Washington. I've been feeling a lot more anxious lately because I really don't want to go to work. Like, it's bringing me to tears to just hearing all these stories and reading all these, like, all the information. The fact that we can't take care of patients like we need to is just, it's unspeakable, it's unbelievable. And I know that I'm a nurse and I signed up for this, but it's how I'm feeling right now. I'm really nervous to head into work, actually. I'm kind of stalling right now because I don't want to go outside. That's how much anxiety I have right now. So yeah. I have my lunchbox full of Rebel cold brew coffee. And then 2 N95 respirator masks that my brother got me. So cute of him. So I just got to work. They're closing most of the entry points to the hospital. We have to get screened for a temperature before we enter and to come to work. Okay, bye.
It feels like we're in a war and like we're soldiers in a war and we're being sent out without camouflage, without Kevlar. It's like we have no defenses against this. I had a fever. Like, I just had a constant fever. I was nauseous and I was very dizzy. It's very painful. It's like, you know, you see your friends and the people that you work with, they're getting sick. I'm out on the first round of it. But people are getting sick and they're out.
34 minutes past the hour, and we're following some breaking news out of New York right now. Some of the hospital staff at Jacobi Medical Center in the Bronx are protesting right now over the lack of protective equipment. Frustrations understandably running high as they put themselves and their families at risk every day.
We are dying. We are getting sick. It doesn't matter how many ventilators we get if we are dead and cannot run the ventilators.
This nurse says she worked for about 7 days at 2 New York City hospitals while infected with the coronavirus. She went undetected because her hospital wasn't testing the staff. She doesn't want to reveal her name or where she works for fear she'll be fired.
I was told the hospital was not testing staff.
You wore the same mask the entire day from patient to patient to patient?
Yes, we do. I'm touching that mask. It's on my face. I'm putting it back on. Virus flies in the air. It goes right up in my nose. It's so easy to get contaminated when you have to put on something that already has virus on it.
So I just finished my 12-hour shift. I'm exhausted. It's now 7 a.m., March 21st. We're trying not to admit too many patients so that we can treat those who are under investigation for COVID. So our main concern right now is just COVID, and leaving beds open. So now I'm gonna head home. I'm gonna completely strip myself head to toe. I'm gonna bleach my stethoscope and my badge. I'm gonna strip all my scrubs down, and then I'm gonna come back and repeat the whole thing. Nurses are actually forced to reuse their N95 respiratory masks. And that just brought me to tears when I was talking to this ICU nurse. It's so hard right now. Nurses are overworked.
I don't know who's to blame for this. You know, it's so much bigger than just a hospital.
We're so tired, and we're tired of feeling like we're not cared for. There's nothing else to say.